Duplex. Next, normal saline with dextrose. This is just only needle, 14 kg, 5 inch. Next, normal saline with dextrose. This is just only needle, 14 kg, 5 inch. Use it for.
Okay, one photo, doctor. Hello? Hello?
This is the drip tube. Okay. In this case, stop. Already 5 days, no eating. Stop eating. High temperature. The tooth is pregnant in 7 months. But when I check now, I put my hand, it's not pregnant. Totally not pregnant. What happened this cow? Sometimes they change food suddenly or something. And they get problem in the digestive system. So now, because she didn't eating, so no power, digestive system no more, Roman no motion, so we give this one to help to give power. Then we will decide it with vitamin and antibiotic and anti-inflammatory can be mostly for 3 days. Okay, so I start to prepare this one. You take the resin. So this one have plastic. So later we take the garbage. No leave any garbage here. This is the valve. Should be blocked. Okay. Then we keep the plastic. This is the valve. Cannula. Okay, now what we do, we press the cannula. 1, 2. We make the liquids half to control the zip. So half cover. Open. Then we open the valve. You see here again? We make sure there is no air inside the tube. No air. Then close. Now it's ready to put.
A 14 grams needle refers to a medical needle with a gauge size of 14. The gauge G of a needle indicates its diameter, where a smaller gauge number corresponds to a larger needle diameter. In the case of a 14 grams needle, it has a larger diameter compared to needles with higher gauge numbers.
The structure of a 14G needle is 1 hub. This is the part of the needle that attaches to the syringe. It often has a color-coded cap to indicate the needle size. 2 a shaft. The shaft is the long, slender part of the needle that extends from the hub. 3 a bevel. The bevel is the slanted tip at the end of the needle. It is designed to create a small incision in the skin or tissue, with minimal trauma during insertion. 4 lumen. The lumen is the hollow inner space of the needle that allows fluids or substances to pass through.
See, blood is coming. Now we take a little bit. We press inside, okay? Now it's ready to give the drip. Give me the drip now. Like this. Come of course. Okay. So now this drip is ready. What I do, I press again until blood is come out. When I put. No air inside. Open. Now you can check here. So This is normal saline. So you can leave this.
Yeah, put in.
This is Zain, my assistant. Now he will flush 500 ml amino plus inside the drip, the normal saline and sugar. So this one's we open it a bit fast because there is no calcium inside. Calcium we should give drips slowly. No, so you can go fast, no problem. Within 5 minutes we finish. After that we continuously with
After that?
antibiotic, some anti-inflammatory. There is many kind of anti-inflammatory like renovate, Volumecure, dexamethasone, also can use, Novalgine, also meloxicam, so Tulsi. All of this is anti-inflammatory. We see which one is the suitable for the scalp and use it for 3 to 5 days. Antibiotic, you can use that, can be good for this case, like endofloxacin, Typhoid, or any kind of this for 3 to 5 days also. So we give the warm also, and she will be okay. That's all. We can do for the scalp. Then we see the result. Start crying. Turkey, Al-Baqarah to Turkey.
Yang ni campur dengan apa?
Campur dengan air sikit kasi dia senang nak.
Ini untuk caci ya?
Cacah.
Tapi banyak bagi? Banyak?
Dia 1 ml 3 kilo. This one around 300, so dia tu bagi 100 ml.
100 ml.
Then,
Ya.
really quick. Okay.
Apa namanya tadi, Pak?
Cacing.
Livoxy.
Finish.
Buat cacing.
100 ml lah.
This one is box. But bendazole, no Siratus.
Oh.
30 ml, 25 ml only.
Kalau kita bagi bendazole,
Ben jangan overdose Hari ni
10 ml Bendazole?
Dia dekat botol tu ada tulis dose.
Zin. Hi. Catch the tail. Yes. Hi. Hi. After treatment, now is coconut time. Bismillah. Subhan Rabbil Azim. Okay, Zain. See you in next video.